plan networks are truly adequate under the ACA. Consider, and they use the example of HIV and the PrEP medication, consider the coverage of pre-exposure prophylaxis, or PrEP, a medication that prevents the transmission of HIV in high-risk populations. For example, gay and bisexual men of color. Insurers were required to cover PrEP without cost sharing beginning in 2021, but not all extended cost sharing protections to the ancillary services needed for a PrEP regimen, like regular labs and provider visits. People who use PrEP had to pay out of pocket for these services. These higher costs led in turn, you guessed it, to lower utilization of PrEP. By extending cost-sharing protections to ancillary services, insurers could have eliminated the cost barrier and made it easy to access this life-saving care. Instead, federal officials had to step in to clarify, which they do quite often. It's incredible that they have to do this because insurers are constantly thinking about what's going to cost them less and make them more money. What's going to cost them less and make them more money? So the federal government stepped in to clarify that insurers must cover these services and office visits without cost sharing. Insurers could similarly broaden cost-sharing protections to increase access to other preventive services where disparities and financial barriers continue to exist, such as colorectal cancer screenings. In a second article published by the CommonwealthFund.org, where they talk about strengthening marketplace network rules for essential community providers as a matter of health equity, they explain how the Biden administration has proposed marketplace plan rules for the 2024 plan year, and provider networks are a core feature of equitable healthcare. Provider networks that are too limited leave members without access to coverage. Now, providing coverage, getting coverage to everyone has been one of the main problems of the ACA. There are people who still fall into that gap where they make too much money to be part of the expanded Medicaid, but they also don't make enough money to purchase one of the plans under the ACA, and so they end up with no insurance coverage. There are still millions of people who fall into that gap. And there are still 10 states, in fact, that have not expanded Medicaid. Most of those states are in the South. And so imagine there are still thousands and thousands, millions of Americans who still live without health insurance despite there being this major piece of legislation and these, I will say, almost changing attitudes about health insurance coverage in the United States. There are more people now who believe everyone deserves it, but insurance companies, as I just explained to you, are not buying into this. They are not doing what the government told them they had to do. They are not utilizing all of the services available to them to ensure that everyone has good quality health care. In fact, they are leaving some things on the table and just going with those basic superficial, we're going to focus on the philanthropy and the social determinants, and we're going to leave this legislation shit alone. It's ridiculous. You cannot have this and this and